Thank you. We're going to have a second round here with just a few questions, and then we're going to then we'll finish today. Did you have a comment?
Mr. Chairman, could I just add one thing? Earlier, Congressman Burgess asked about the moratorium on school-based services. There is, in the final slew of things that went on, there was a moratorium put into the final bill, and there is a moratorium on implementation of that regulation. That's a final rule, but it was put on hold for 6 months.
6 months, yeah.
But if after 6 months we don't do something about it, it's going to go into effect, and that's really deadly.
No, we're very much aware of that, and that's one of the reasons why we're having this hearing today, actually.
Just wanted to make sure.
Absolutely. I just wanted to ask, oh, I'm sorry, you're next. No, you're next. I'm next? All right, I'm next, okay. I wanted to ask about the Class Act, and I guess I would ask the same Dr. Rowland or Ms. Fortin again. Part of the reason I introduced the Class Act is because I recognize that utilization of long-term care services is on the rise and is going to increase as the population continues to age. And I think many Americans are under the impression all their health care needs, including long-term care needs, will be covered by Medicare when they're older. I know that sounds incredible because you're all so knowledgeable, but it's true. A lot of people really believe that. What they don't realize is that Medicare doesn't really provide these types of services only in limited instances. And as a result, they don't plan ahead. So if I could ask Dr. Rowland or Ms. Fortin, could you comment on why it's important to get Americans to think about their long-term needs sooner rather than later, and how a voluntary opt-out system like the Class Act might work, and whether you think it would be beneficial to achieve that goal?
Well, I certainly think that we are facing an aging issue and a disability issue that cannot be solved by Medicaid alone. And one of the real challenges that has always been there is that when we get to the kind of long-term care services and supports that people need, they don't get them through the Medicare program, and they can only get them through Medicaid if they meet the most strict income and asset tests, and therefore have to be virtually impoverished to be able to get any assistance. So as we look at the challenges of an aging society and the challenges of a society where people with disabilities want to live at home and in the community and not be forced into institutions, I think anything we can do to promote broader options to help improve access to these kinds of services at levels of income that are not so means-tested as the Medicaid program. It's not to say that Medicaid isn't critical and isn't an underpinning, but I think we really need to begin to look more broadly at how we can build some of these services either into a Medicare-related program or into a more Title 20, we used to call it Title 21. Title 21 has now been used for something else, but to really try to have a way in which people can early on begin to contribute toward having the security of a broad and long-term care and supportive services set of programs to wrap around just as well as the Medicare medical benefits are there.
Thank you. Ms. Fortin, did you want to comment?
Well, we're really supportive of this because working with people with intellectual and developmental disabilities, one of the huge issues is their ability to buy into a long-term care program. So this would remove some of the biases that they might face. And again, you know, we go back to the whole issue of everybody needs to worry about long-term care, whether it's for a family member or for themselves. Eventually, the majority of people are going to need these services in the future. If we can put a program in place that will reduce the need for the Medicaid system, and also for individuals don't have to impoverish themselves in order to be eligible for the Medicaid system. So the Class Act goes a long way to meeting several of the needs.
All right, let me just finish up and going back to, thank you, Ms. Beckett's point about this 6-month moratorium, you know, that on the CMS rule that limits rehab services under Medicaid. Would you just tell me, you know, what's, you know, talk about the consequences, if you will, if this were to go into effect? I mean, obviously we don't want it to, but if you talk about that.
Well, I think one of the major consequences is school districts in this country will be forced to choose between healthy kids and kids in special education. I don't think that's right, and it's absolutely against the ideal of education and the importance of education in this country. I think in many ways what it will do is those administrative costs allow for the ability for them to do some kind of care management in a school classroom, whether it's paying for a school nurse, helping to pay for a school nurse in that building, or what's going on. But I think it's really important for us to think about the therapies that these kids really need, in particular physical therapy, occupational therapy, speech therapy in particular. Those kinds of things will be restricted, and we can't afford to have that happen. We really want our young people, our young adults, to be ready to go into the workforce, and they're not going to be ready if what we do is restrict those kinds of reimbursement for those types of services.
Okay, thank you. Mr. Deal?